Hello everyone, this is Casey, occupational therapist here at Edgewater. Today we're going to present what have been the Thrive March presentation. Again, on behalf of myself and the rehab department, we're hoping everyone is healthy and staying safe. And again, if you ever need any of us or support or even just any questions, please feel free to call the rehab department at any time. So today we are going to be talking a little bit about thriving with good balance. So today's focus is a little bit on what can cause balance issues and how rehab can help. So if you remember in our February presentation, we learned about balance and what we need to do to achieve good balance and reduce our risk of falls. Today we are going to expand on that and talk about some common conditions that can cause falls and make us feel pretty miserable. As we know, falls can lead to fractures and head injuries, so it's very important to prevent these. We are going to talk about dizziness, vertigo, and a condition called disequilibrium. We will talk about what these things are and what causes them. And lastly, we will talk about things you can do to reduce and prevent them. So what is dizziness, vertigo, and disequilibrium? Dizziness is a feeling of lightheadedness. Have you ever jumped up too fast and felt woozy? That's dizziness. Vertigo is a sensation that you are spinning or the room is spinning. If you have ever had vertigo, you know what it is. Disequilibrium is the sensation of feeling off balance. Our residents sometimes describe this as feeling drunk, not being able to focus, not feeling right in the head, or trouble seeing things clearly while walking. Did you know that dizziness is the #1 reason that older adults go to the emergency room? Dizziness is very common, but we want you to understand that it is not normal. What do you think is the #1 cause of dizziness in older adults? It is medication side effects. Have you ever seen this may cause dizziness on the side of your medication bottle? It is important to notify your doctor if you have dizziness after starting a new medication. The first 3 days after starting a new medication is when most falls occur. So this is just an example of what a side of a pill bottle may look like and just what a sample of the label may look like if it does in fact cause dizziness. Last month, we talked about 3 systems involved in human balance. They are the eyes, ears, and your joints, muscles, and nerves. Today, we are going to focus primarily on the ear, which is actually called the inner ear or the vestibular system. So this is just a little bit of an anatomical picture of the inner ear. Let's talk about what the inner ear is. The green part that you see in the picture is the external or outer ear. It's the part of your ear you can see and feel. The part where ladies or gentlemen wear earrings. The part that you should never stick a Q-tip in. The blue section is the middle ear. This is where the organs of hearing are located. What we are talking about today is pictured here in the orange. This is the internal or inner ear. This area is actually part of your brain, and it is housed in the bones of your skull. It is not visible to your doctor when he looks in your ears with the light. Here is another picture of the vestibular organ and where it is located in relationship to your ears. This amazing little organ is only the size of a dime on either side of your head. This organ holds the semicircular canals, which you may have heard of. These canals are filled with fluid, and when your head moves, the fluid moves. The moving of fluid gives information to your brain about what the body is doing, such as spinning, turning, going up in an elevator, accelerating forward, such as when you hit the gas in a car, and when you brake in the car. So sometimes people can have issues with the vestibular system, which will in fact lead to dizziness, vertigo, or disequilibrium. So what causes dizziness, vertigo, and disequilibrium? There are many causes of these three symptoms. One person can have several of these things at the same time. Medications, as we said, are the most common cause, but there are many other things. So medications, heart arrhythmias, blood pressure changes, your blood sugar being too high or too low, vision problems, anxiety, migraines, concussion, disease of the brain and nervous system, neck pain, inner ear diseases, virus in the inner ear, and crystals in the inner ear. We're going to focus on the last two because these are the things that many people don't know that rehab can really actually help with. So viruses in the inner ear and crystals in the inner ear. So what are some common side effects of viruses in the inner ear? The first one we will discuss is a virus called neuritis or labyrinthitis that causes inflammation of the nerve in the inner ear. This is common, and the virus like this or virus that causes this may come on as a cold or the flu. Except in this case, the virus affects the inner ear and causes sudden severe vertigo and nausea. In some cases, there is a temporary hearing loss. This may have happened to you or one of your friends. There is a dizziness or vertigo that seems to happen all of a sudden. Many people feel so bad that they end up going to the emergency room. There is usually a CT scan of the brain to make sure the person isn't having a stroke, and they are to send home within a day. However, some people don't recover very well and continue to feel woozy and wobbly. This is when physical therapy can help. So what does treatment look like for viruses in the inner ear? In the first 3 days, the person should be treated the same way as if they had a cold or flu, lots of rest and fluids for the first few days. The doctor will likely prescribe a medication for vertigo, or sometimes they will not. It is important not to keep taking these medications once the severe vertigo subsides. They can stall the process of recovery in the brain. They are not meant to be taken long term. Talk to your doctor about when to stop taking these anti-vertigo medications. If you do not recover within a few days, it is important to seek help from a physical therapist. A physical therapist can prescribe eye and head movement exercise that help the brain recover and exercises to improve your balance. So again, we just want to stress that these anti-vertigo medications do not prevent symptoms from coming back, and they can make it longer to get better. Only use them during the severe phase. If you are not sure when to stop taking them, ask your doctor. Have you or a friend ever been told that you have crystals in your ear and that is what can be causing your dizziness? This condition has a fancy name called BPPV, or benign proximal positional vertigo. We all have crystals in our inner ears. They belong there to help give more information to the brain. However, sometimes they get dislodged from where they belong and float to another part of the inner ear called the semicircular canals. When crystals are floating in the semicircular canal, they cause the fluid to move, like we talked about earlier. That causes the brain to think that you are spinning. Typically, this will be noticed when moving the head and body into certain positions, such as lying down, rolling over in bed, washing your hair in the shower, especially when your head is tilted back, laying back on the hairdresser or dentist, or bending over to tie your shoes. So BPPV, the bad and good news. So the bad news is BPPV is very disconcerting and can cause nausea and vomiting. It's dangerous and can cause falls. But the good news is a physical therapist can usually cure this BPPV. And the best news is that they can sometimes help it within one session. While the word benign is the name, it is not a harmless condition. The severe vertigo can cause serious falls and injuries. But like I said, the best news is that physical therapy can help and usually only takes a minimum amount of sessions. We don't get to hear the words usually that said, I can cure you in one session very often. But simple cases of BPPV can be cured in 1 to 3 sessions. What does rehab do for dizziness, vertigo, and disequilibrium? Depending on the cause, there are many effective treatments, such as eye and head exercises to improve function of the inner ear, specific head motions to move crystals back to their home and cure BPPV, treatment for headaches and neck pain, treatment for anxiety-related dizziness, treatment for disequilibrium imbalance, exercises to teach your brain to adapt dizziness, advice to reduce risk of dizziness and causing of more falls. Good nutrition can reduce dizziness. The wellness lecture for March is about nutrition and is called Mindfully Eating. Be mindful of what you eat. Here are some tips our dietitians want you to know about nutrition and dizziness. Avoid excess salt. Drink adequate fluids to maintain hydration. Eat regularly to maintain a stable blood sugar level. Include sources of vitamin D and calcium to promote bone strength. Plan on good sources of protein such as seafood and beans to keep your muscles strong. Too much salt affects blood pressure, which can cause dizziness. Dehydration can cause dizziness. High or low blood sugar can cause dizziness. A lack of vitamin D can cause bones to become soft and prone to fracture. So it's very important to eat good sources of protein because strong muscles can help prevent falls. Remember, dizziness is not a normal part of aging. Vertigo is not a normal part of aging. Neither is disequilibrium. You don't need to, quote unquote, just live with it. It's very important that if you're experiencing these symptoms, to either reach out to your doctor, healthcare professional, or therapist and express your concerns. Remember, dizziness can lead and often leads to falls. And as we want to do with everyone, is our main focus is to prevent falls from occurring. So if you have any questions about maybe some medications that you're taking that can cause dizziness, or if you have any concerns about dizziness, it's very important to reach out to your healthcare professional. So what should you do next? You can talk to your director of rehab, which here is Stephanie, if you're experiencing dizziness, vertigo, or disequilibrium. You can come to any of our chat with a therapist and ask questions about how rehab might be able to help you. So unfortunately, like we said, our chat with the therapist is currently not going on because of everything happening. However, as we discussed in our last February-based lecture, you're more than welcome to always give us a call in the rehab department, and you can ask to speak to any of our therapists and Stephanie, who is our director of rehab, and we can talk you through about with what your symptoms are and to see if therapy would be appropriate for you. If you have any questions whatsoever about this lecture, if you would like to learn more about anything we reviewed, or anything about BPPV in general, please don't hesitate. Just give us a call and we'd be more than happy to help you. We hope that, again, everyone is staying healthy and is practicing good social distancing. And I just wanted to let you guys know that we're going to have another seminar for what would have been our April lecture. And that subject topic is going to be thriving with good strength. So we're going to be learning a little bit more about managing back pain, arthritis, and joint pain. So be on the lookout for that. We'll be posting it, which will be running on channel 95. And if you have any questions about when it would be airing, I would reach out to to Alyssa, or you can reach out to therapy as well, and we can let you know the date and time to when that April seminar will be running. All right, everyone, stay healthy and safe.